The government will introduce standardized counseling manuals for parents as well as impose restrictions on content on the digital platforms as it seeks to address the triple threat of sexual, gender-based violence, teenage pregnancy and early marriage. The triple threat has been identified as one of the key drivers of HIV infection among the youth and adolescents. Achola Simon with the details.
As the government grapples with increased HIV infections amongst the adolescents and young adults, provision of sufficient, timely and relevant information to this key group may be the antidote needed to check the rising numbers.
With these threats, what is very key is information. I mean the youths getting information, proper information. And as a ministry and as a government, we have made sure that we get information all the way, going all the way to the primary and secondary education.
When adults have sex with children and they become pregnant, that is sexual and gender-based violence. So we must never look for excuses that we want to discuss teen pregnancies separately and we want to discuss sexual and gender-based violence separately.
Adolescents and young adults account for more than 80% of new HIV infections in the country.
But in most cases, there seems to be gaps in the health system, including the adequate resourcing for the same services, and also providing adequate care that then encourage access to these health services.
Kenya indeed has very good laws and policies in place, but when we're looking at reproductive rights, especially towards adolescents, there's a gap, especially in the recently passed reproductive health policy.
The stakeholders spoke as they convened in Kisumu to deliberate on drivers of triple threats of sexual gender-based violence, teenage pregnancies and early marriages. Achola Simon, Prime Edition, Kisumu County.